every day. This is Local 24 News at 10.
Well, tonight, news unfolding on several fronts about the coronavirus here in the Mid-South and across the country. We are here to give you the facts about what is happening and not spread fear. Good evening. I'm Richard Ransom. Katina is off tonight. There are now 4 confirmed cases in the state of Tennessee. 1 case here in Shelby County, the other 3 in Middle Tennessee, including Davidson and Williamson counties. Now, nationwide, there are more than 720 cases. Health experts maintain that the risk to the general public is low, although more than 100 Mid-Southerners are among thousands nationwide being monitored or in quarantine. In fact, 5 Republican congressmen, including the president's new chief of staff, are now self-quarantining after coming into contact with a patient. The White House said the president has not been tested. Also, at least 9 states declaring states of emergency, and Tennessee Governor Bill Lee says he's considering it as well. Now, we are learning more tonight about Shelby County's only confirmed case. Not a lot more, because health officials won't give the patient's gender, age, or even where they traveled. But we do know he or she is being treated at Baptist Memorial Hospital and came into contact with at least 70 people now being quarantined, including a person who works at a Shelby County school. Local 24 News reporter Caitlin McCarthy shows you how both Baptist Hospital and SCS are taking reasoned precautions, emphasizing facts over fear.
Richard, as a precaution, the nurses and doctors at Baptist Memorial taking care of that patient are wearing masks and protective clothing. Both the schools and the hospital working to minimize the spread of the disease. The Shelby County Health Department says an employee at Treadwell Elementary School is one of 100 people who came in contact with the patient who has a confirmed case of COVID-19. The employee is among 70 people in a 14-day cautionary quarantine, but health officials say the risk for the virus remains low.
And the reason that we do that is that if they become sick at any point, after having been in contact with the case, we know that they can't spread the disease to other people.
County health officials say 100 people came in contact with the person in Shelby County who has the virus.
We know that the individual who is diagnosed has traveled.
As the team at Baptist Memorial Hospital treats the patient with the virus, they are taking cautionary measures to prevent the employees from contracting it or spreading it. The patient is in a room where the air is contained, and employees who come in contact with the patient are wearing protective masks and coats.
With the flu, you're really talking about larger droplets, and neither of these infections has been shown really to transmit in less than about 3 to 6 feet. So they don't spread across the room. Now you say, why are we in negative pressure? Because we are still learning about the virus that causes COVID-19.
Dr. Threlkeld says the hospital is in the process of setting up screening stations for people with respiratory symptoms before they walk in the waiting room. He says these will be important if there are more local spread of the disease. Live in the studio, Caitlin McCarthy, Local 24 News.
All right, thank you, Caitlin. This just in, 2 Southwest Tennessee college students are in self-quarantine after learning, that they came into contact with the patient at Baptist Memorial. Meantime, the Shelby County Health Department updating county leaders tonight on the confirmed coronavirus case in Shelby County. Dr. Elisa Hochschild addressed tonight's county commission meeting, saying health officials have been in contact with 100 people in Tennessee and Mississippi who came into contact with this patient. And while 70 are being monitored in quarantine, as I mentioned, Hochschild says none of those people have been tested because none have shown any symptoms of COVID-19.
This individual contracted coronavirus through travel. That's important because that means to us that there's not increased risk for community transmission at the current time.
The Shelby County Commission is urging everybody to take this matter seriously. These flyers were posted on the door into the commission chambers tonight. As a precaution, they've declared their meetings a handshake-free zone. Well, some of you are asking why we're not reporting if Shelby County's coronavirus patient is a man or a woman, where they traveled, or how old they are. Well, we know that about other Tennessee patients. The Shelby County Health Department says it's private. What do you think? Do you think the public has a right to know such basic information about a patient, especially when there's a pandemic as we are in now? That's tonight's live viewer vote question. Just go to localmemphis.com/vote. Look for results at the end of this newscast. Memphis City buildings are being wiped down with disinfectant over this. The Shelby County Jail and other buildings are getting the same treatment. Memphis Mayor Jim Strickland says it's a cautionary move, not out of panic, just being proactive. There's a lot of speculation face masks can help prevent you from catching the coronavirus, but the CDC, as we've been telling you, recommends against it, saying it's absolutely not necessary. Here are the facts. The health department says you should instead diligently wash your hands for 20 seconds, especially after sneezing or coughing, also when caring for someone who is sick, before, during, and after preparing food, and after handling a pet or a pet's waste.